News and information from Georgia State experts about the current global health crisis. This is 88 Affairs, a program for our Georgia State University community and WRAS listeners. I'm your host, Andreas Preuss. Joining me for a conversation about spreading reliable information during this pandemic is Kim Ramsay White. She's the Georgia State Undergraduate Program Director and a Clinical Assistant Professor in the GSU School of Public Health. White is also leading a public health campaign for student ambassadors to share information about the pandemic. I'll also be speaking with Daria Dozier, a member of the Georgia State Student Emergency Response Team. Dozier is a senior and a double major in theater performance and Spanish. Dr. Kim Ramsay White, thanks for joining me.
Oh, you're welcome, Andreas.
So tell me a little bit about your campaign with the student ambassadors to share information about the pandemic.
Early in the summer, probably right around June, I was approached by Dr. Angela Christie, who is the faculty director for the College to Career Initiative and in the Office of Student Success, to give some thought to how we might best serve our students on campus in terms of them feeling comfortable returning to campus with everything that was going on as far as the pandemic was concerned. Without question, in June, we knew much less than we do now, but we did know that if we wanted our students to be able to have even some baseline sense of normalcy, that the best way to make that happen would be to make sure that they had the information that they needed to be able to have someone that could answer questions for them. And it also was in thinking about developing a group of students who would be able to provide those services. We also saw that it was a great way to give our students some of the practice and some of the career competencies that they need to continue to develop while they're in college. So we knew that this initiative would help them with their oral skills and their written skills and working on a team. And, we just saw it as a way to really kind of have a win-win situation whereby our students were able to have a peer that they could reach out to ask questions of, but then also that the students who were selected to be ambassadors would get some really great boots on the ground experience and a really practical approach to apply their career competencies.
Well, you saw that a sense of normalcy kind of dissipated in spring of 2020 when Georgia State, as many colleges around the country, went to an emergency transition to online learning and just kind of things up in the air. And then you also had people dealing with their own issues, whether that was employment or housing or even a sick family member. So this kind of return to normalcy would be an important factor for the students.
Oh, for sure it would be. And when I say return to normalcy, trust me when I say some basic sense of normalcy, because I don't personally think we'll ever go back to doing school, doing life the way that we've been doing it before. But in the context of the fact that the university was going to allow students to come, a certain number of students to come on campus and actually live in housing. There were going to be blended classes and students were actually going to be on campus. When I say some sense of normalcy, we had to kind of create this new normal. And we wanted to be able to make it such that students, weren't really overly apprehensive about it, that it wasn't another source of tension. And of course, there was still going to be some tension, but we felt that if there were this team of ambassadors, that we'd be in a better situation for students to feel connected to other students who were navigating these spaces and could be good role models for how to actually practice the safety precautions that needed to be done on campus.
Do you think it was a bitter pill? Or is it a bitter pill still? I mean, what you just said that, things may never return to normal, at least the way they were pre-pandemic, that you have students coming in and they're expecting their college experience, which, most of us had pre-pandemic, whether it was, attending football games or concerts or student organizations, meeting with a bunch of people, like I said, without wearing a mask or social distancing. That's got to be a kind of a tough thing to go through as a college student at this time because things are so different. And you're saying that, we just kind of got to get used to the way it is right now.
For sure. One of the big tenets, if you will, of our campaign was to try to help our students, our GSU community, really, because, we're focusing on students as far as our ambassador team is concerned, but it's so much bigger. I'm sure, as you know clearly, that it's not just our students. There would be faculty members who probably have, who could have some, disregard for not wanting to wear a mask. But one of the big pieces that we really wanted to press, that we thought would be more of a rallying point, was that we needed to create a community of care, that we needed to be able to help people to know and understand that, wearing a mask is difficult, and it's as much to protect you as it is to protect the other person next to you. And that's what we do when we care about people, when we're in a community where we're trying to help everybody be better and everybody to be able to live better. And Andreas, truth be told, that's a different paradigm for us as a country. That's a different paradigm for a lot of people to think more collectively in terms of the greater good than it is to continue to operate in the kind of individual ways that we do. And so thinking that, if students had an opportunity to see other students model this behavior, model what it means to be caring for other people, that we stood a better chance of getting some success with students being able to do those things, as opposed to me as a faculty member or some other adult just standing there. And I like to compare it to Charlie Brown's teacher, which a lot of our students don't even know who Charlie Brown's teacher is. But how when Charlie Brown's teacher is in the front of the room, and really what you hear is wah, 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 wah. You don't really hear what people are trying to tell you because you're not tuned into it anymore.
And we're going to be speaking to a student ambassador during this interview, so we're looking forward to that. To get back to your point about the cultural differences, and as a public health official in the School of Public Health, did this surprise you? And I speak about, that the American public is different than, let's say, the Canadians or the French or the Germans or the Japanese or people in South Africa, that we are not a collective society, meaning that, we don't just follow the rules. I mean, America was founded kind of on being different and having freedoms. How do you think this played into the whole making of the pandemic a political issue involving mask wearing, social distancing, online education, and even when it comes out, I'm sure the vaccine will become political. Did this surprise you as a public health official?
Oh, no. No, it doesn't surprise me at all. I mean, it doesn't surprise me because as a public health practitioner, and I'm not even really a public health practitioner, I'm an educator in public health, and I have a public health degree. But, through the research that we do, through the knowledge that we have about disparities in health in this country, it's clear that we have very different ways, and that, again, because of income inequality and, vestiges of just marginalization and discrimination in this country, there are unfair ways and inequitable ways in which people navigate through these spaces that we call life. So inequitable in terms of how we have access to education, inequitable in terms of even having access to what we needed to be safe as far as this pandemic is concerned. And this will take us a little bit off of the student ambassador piece, but then again not. But we knew probably by the middle of April, why it took that long, who knows, but by the middle of April, we already saw that there were disparate outcomes in terms of infection, disparate outcomes in terms of death for people of color. And why is that? Because they were more the essential workers. They were more the people who had to be out there doing the work. They didn't have jobs that they could telecommute to. And that's just indicative of the way we are as far as our society and how our society is structured. Some of the students who are on our student ambassador team also participated with a group of students that created 3 student video modules, if you will, that our student ambassadors use in their presentations. And one of those modules was on disparities and why we have disparate outcomes as far as COVID-19 is concerned. And the reason we created that is because, again, because of the diversity here on Georgia State's campus, and because we have a large number of students of color on our campus, we needed everybody to know and understand that there could be potentially populations on our campus that were more susceptible to this virus than others. And so again, not trying to single any group out, but wanting people to be informed appropriately, capitalizing on the community of care and why it's important to wear your mask also stems from why we have disparate outcomes.
I'm speaking with Kim Ramsay White, the Georgia State Undergraduate Program Director and a clinical assistant professor in the GSU School of Public Health. Dr. White is also leading a public health campaign for student ambassadors to share information about the pandemic. And you just did bring up the very diverse makeup of the Georgia State community, and you hit upon how that is an important factor in this program.
Even in the videos that we created, we have a diverse group of students who are represented in the video. And while the video is animated, it's clear that we have a diversity of ethnicities, of diversity of races, a diversity of gender that are represented in those videos. So that, again, in hopes that people would see themselves represented in those videos and be able to know that that the information that we were giving was applicable to them.
Or accurate information, or i.e. the truth about mask wearing or social distancing, which gets us back to, once again, the polarization of COVID-19. Do you think that Georgia State in the initial days and months was as transparent as it could be about cases that were on campus? And I only reference this because there were open record requests filed to get some of the information, because if you looked at the Georgia State website, they had 2, 3, 5 positive cases when, there's 54,000 students enrolled, not necessarily on campus because they weren't.
It's a few thousand students that we have on campus in terms of living in housing. And so, no, it's important for sure to be able to have accurate testing. In addition to our own housing that we have on campus, there are a number of for-profit residences around campus that house our students as well, that we don't have any way of tracking or knowing what's happening as far as those students are concerned. To get back to your question about whether or not I feel like, Georgia State did all that they could, I can tell you 100% all summer long, people, administrators, staff people, everybody was doing the best that they could, the best that they knew what to do as far as reopening our campus safely for our students, our faculty, and our staff. That much I know for sure. Dr. Lynn, who's the interim dean for the School of Public Health, was on the task force for, safely reopening the school, in addition to working very closely with Dr. Azanobi, who is the medical director for the university. So the pieces were in place. And Andreas, I think that everybody has to understand, like, this thing keeps changing, and people, I think, are giving their best efforts with the information that they had. And that became an issue for us as far as even training our ambassadors is concerned. Over the summer, it was wear your mask, wear your mask, wear your mask. Mm-hmm. And again, we can get into the whole polarization of things, but then CDC kind of changed, and maybe it's okay to wear a mask, and then no, you definitely have to wear a mask, and you're still getting conflicting information about whether you need to wear a mask or not.
Yeah, that's an issue, because things were very confusing about mask wearing, and then social distancing, and then even is 6 feet enough? And then you had online, we should get students back into a classroom, but then it's not safe for the teacher. Yep. And then school districts went online, but then parents protested, we want our kids in school, but then they had outbreaks, and it was just a kind of a ball of confusion involving the public health messaging, and not just from the federal government, but from the CDC, from state and local. It was just kind of a very confusing situation. So is your student emergency response team, is this something that you said they're aware of this, and kind of separating fact from fiction as much as one can, involving messaging?
We had to have some consistent place that we felt we were getting the most reputable and consistent information from. And so that information for us was from CDC. And did it flip-flop and change? It did. I have three other faculty members and staff two other staff people who have worked with me with training the students and getting the students the information that they need. And so they reference multiple other sources as well. And I could not tell you off the top of my head if you get a chance to watch the video. There is one video called The Infodemic, and it speaks to the just exorbitant amount of information that was out there regarding the COVID-19 and what best practices were. And so they drew on, I know from CDC, from WHO, and then I don't remember what the other organizations were, but we did the best that we could with the information that we had to try to give as accurate information as possible.
I'm speaking with Kim Ramsay White, the Georgia State Undergraduate Program Director and a clinical assistant professor in the GSU School of Public Health. She's also leading a public health campaign for student ambassadors. Also joining us for a discussion is Daria Dozier, a member of the Student Emergency Response Team. She's a senior and double major in theater, performance, and Spanish at Georgia State. Daria, you're an ambassador. Tell us what that entails.
As an ambassador, it is my role to gather the most up-to-date and accurate information about the COVID-19 pandemic and relay that information to Georgia State students in a way that is comprehensible for them. I also serve as a representative for Georgia State students because I am a Georgia State student, so things that the directors of our program may not consider or understand, we as ambassadors can bring up. So serving as a leader for the Georgia State community and also as a representative for Georgia State students.
And how important do you think the point is that Dr. White made about how students want to connect with other students? And let's just say, young people to young people instead of the monotonous droning of adults or, like she said, the Charlie Brown teacher. Is it important for students to connect with each other?
I think although we're all struggling through this pandemic at this time, we're all struggling in different ways. As students, it's very easy to feel like people who are older than us in the Georgia State community, so our professors or maybe a counselor that we're speaking to can't relate to us in the same way that other Georgia State students can. And it's just important to know that the person you're talking to and that is trying to give you information and to assist you can relate to the things that you're going through as well.
And what are some of the events that you've held?
So far we have had a few presentations for GSU 1010 classes. We also had a presentation for the Student Government Association, and we sat in on a meeting with people in the School of Public Health. We were talking about ways to get students who are in housing on Georgia State's campus to want to get tested for COVID-19.
I'm a student myself, so I can relate. I do want to ask, is there a thought? Dr. Ramsay White spoke about how things have changed and your college experience will not be what it was a year ago. Is that a sobering thought for students, or is it just kind of like, we got to get on with it? What's your kind of take on just the whole kind of attitude of being a college student today?
I think it varies day to day, week to week. I think a lot of us now are at a point where we've adjusted a bit more to it, which is why a big part of our presentation that we have, my segment specifically, is talking to students about safe ways to kind of gather and socialize, because we've been in this for almost 8 months now, and we're getting to the point where people have to stop trying to survive and actually live, but we also want to be as safe and respectful of other people's health as possible. But there are still days where I get up and I log on to iCollege and I'm like, wow, I'm still doing this. I am scheduled to graduate in spring of 2022, and to think that the world that I know might not be back to quote unquote normal by then, it's a bit disheartening sometimes. It really is.
Well, and there's counseling services provided by Georgia State as well to deal with those situations, and that's a great resource to have on campus. And I've done interviews about that with the health and wellness director. Did you ever encounter any student saying, and I know this is a crazy thought, but it was out there that let me just get the COVID and get it over with? Have you heard of anything like that? I mean, there were reports of parties on campuses, not necessarily Georgia State, but other campuses that were very well reported in the news that kids were just gathering to get the COVID. I mean, that just seems ridiculous, especially for a certain segment of the population that could be more adversely affected. Did you run into any thoughts like that?
I have not had those thoughts myself, but I do have peers that have said things similar. And I think another thing that a lot of college students and young people in general have had to deal with during this time, myself included, is facing, I guess, our own mortality. And that's not something you really think about when you're a 20-something. So I think it's just young people thinking that they're invincible, that they'll get it and it won't be that bad and they won't get that sick, and also forgetting the fact that they can get it and be asymptomatic and potentially expose other people.
All good points, and of course we don't know the long-term effects of the COVID, meaning that yes, you could get it and have a minor issue, especially young people where they may just have a fever and need bed rest and maybe lose the sense of taste or smell. But then in 20 years, who knows? There could be lung issues or some type of lingering effect we just don't know. So Daria, what advice do you have for students at Georgia State involving your program?
I would say to check out our website. It's publichealth.gsu.edu/SERT, SERT. I would say if you need someone to talk to, reach out to the Counseling and Testing Center, because those resources are there and they're there to help you. On our website, we have our 3 videos. They're all very short, I think around 3 minutes. They're animated, they're simple, they're fun, and they're very informative. I definitely recommend giving them a watch. And if you have any more questions outside of that, Dr. Ramsay White's information is on the website, and feel free to reach out to her, because we're here for the students. We're here for you all. We're here to keep the Georgia State community as safe and as healthy as possible.
Well, we're all in this together, and we can all either be miserable together or get through it together. And I think some of the work that you are doing is certainly assisting people with that effort to just marshal on and do your studies and deal with it the best way possible.
You know, it's one thing for us to have a conversation and to stay really focused as far as combating this COVID pandemic, but we would absolutely 100% be remiss to not mention the fact of all the racial and social injustice that we have had to deal with this summer as well, on top of this pandemic. When we think about working and talking with our students on campus, you just can't ignore that. It's not, there will be certain populations on campus that, in addition to managing and trying to deal with the stress that comes from this pandemic, are also dealing with this historic sense of, for me, sometimes it feels hopeless, but I feel like I have a little bit more hope now that we can actually make some change in terms of race and social justice. But the racial injustices and social injustices, they tie in with the pandemic as well, which is why we saw such disparate outcomes in our students of color.
That's a good point. Thank you, Dr. Kim Ramsay White, for joining me today. Also, Daria Dozier, a member of the Student Emergency Response Team's Georgia State Ambassador. Thank you.
Yes, it was very good to be here. Thank you so much, Andreas. Thank you for taking the time to talk with us.
Thank you so much for having us.
This is 88 Affairs. News and information for the Georgia State community and WRAS listeners. Views expressed in this program are not representative of Georgia State or the GSU radio station. For more on-program content, please follow at WRAS 88 Affairs on Twitter. I'm your host, Andreas Preuss. Thanks for listening.